The final standard of the reproductive unit discusses what happens if fertilization does not occur. So the process of menstruation is how to regenerate the reproductive cycle for females, and we'll also discuss various methods for birth control, including their cost and their efficacy. So the standard reads, I can describe the process of menstruation and the mechanisms of a varied collection of birth control measures that prevent fertilization. Okay, OVUM.3. Let's start with the female reproductive cycle. So we mentioned in the last video that women have about a 28-day cycle during which the lining of their uterus, known as the endometrium, is increasing in volume in order to receive and host the development of an embryo. If there is no embryo, then we have to culminate in the menstrual bleeding or menses, by which we shed that thickened uterine wall and then begin the process all over again. So menarche is a special name for the first reproductive cycle that happens in women, and usually it's about age 13, though there has been studies done that show it's getting earlier and earlier in a woman's life. Oftentimes, the age range for a woman to experience menses is from her early teens into about her 50s. So those are the ages in which she's fertile, though after the age of 35, fertility drops dramatically, and we refer to that as advanced maternal age. So each month, usually one mature oocyte is ovulated from the ovaries and released into those fallopian tubes. If fertilization does occur, the embryo will implant in the uterus, and we zoom off to unit 16. If fertilization does not occur, then our oocyte has to break down and our uterine lining, our endometrium, has to disintegrate and slough off, producing a menstrual flow. Here's a diagram that shows over the course of a 28-day cycle how the first few days are characterized by a shedding of the last endometrium, and then that's your menses, and then we're increasing the uterine lining, reaching peak fertility around day 13, hoping that we'll get an embryo, host it, and then we realize by around day 28 that that didn't happen, and the uterine lining is shed, and the cycle begins all over again. This process highly regulated by hormones like estrogen as well as progesterone. These are some products, some sanitation products that women use to go about their daily life while experiencing menses. So we have a tampon, which is inserted into the vagina up towards the cervix, and a string for retrieval. This is a tampon with a plastic applicator cover. We have a menstrual cup that can also be inserted into the vaginal canal to collect the menses and then be washed out and reused, a very economical option. And then we also have pads and panty liners, which are not inserted, so nothing is put into the woman's body. It simply collects the blood and the products of menses so that it does not drip out into her clothes. When a woman reaches late 40s or early 50s, reproductive cycles cease, and that is known as menopause. At this point, the ovaries are not producing eggs anymore, but they're also not producing as much estrogen or progesterone. And so we might start to see some of those secondary sexual characteristics disappear. We may see a reduction in desirable fat deposits or a shifting in fat deposits. We also have about half of women claiming to experience hot flashes, migraines, and fatigue during this time. All right, the other half is how do we prevent fertilization if we don't want it to occur? So birth control is defined as the voluntary regulation of the number of offspring produced and the time they're conceived using some type of contraception to either prevent the fertilization or the implantation. There are four primary categories we're going to discuss: behavioral, physical barriers, chemical, or surgical. So there are two behavioral methods, the rhythm method and coitus interruptus. In rhythm method, a woman avoids sexual intercourse during her window of fertility. So most fertile around day 14 or so, less outside of those very fertile days. So if she avoids having sex on her most fertile days, then hopefully pregnancy and fertilization won't occur. The problem is it's difficult to predict exactly when a woman is ovulating. She can have stray cycles that don't follow her typical 28-day. It's about 80% effective, so 20% of people will still get pregnant if they use this method, but it's free. A lot of women used to use paper calendars. Now they have apps for following and tracking your cycle, so 21st century rhythm method. Coitus interruptus is a fancy name for removing the penis from the vagina before a man ejaculates. The problem here is that it is difficult to effectively time, and it requires trust and complete control of the male. It is about 80 to 90% effective if done properly and is also free. Neither of these methods are terribly effective because they both rely on human behavior. All right, what if we just put a physical barrier up? Just put it up between the penis and the vagina. That way the sperm can never get there. Great. There's a male and female option. The male condom is the latex one. I'm sure you've seen them. They're worn over the penis to prevent sperm from entering the vagina. Problem here is that a lot of couples report it's disruptive to the mood, and bigger problem, it can slip off or break. So it is 88 to 98% effective, and it's really cheap. It can be free at a lot of health centers, or it can be a few bucks at the drugstore. Diaphragms are a female option. So this is worn in the vagina up against the cervix, so it has to be inserted. Typically, a doctor is needed to fit you with the right size diaphragm, and it can both slip and get stuck. I'm told that diaphragms have fallen out of favor and they're just not that common anymore, but they're 82 to 94% effective and cost 15 to 50 bucks and a doctor's visit. Okay, what about chemicals? Well, used in conjunction with condoms and diaphragms a lot is spermicidal jelly or spermicidal lube, which can chemically denature and kill the sperm before they even reach the egg. 80 to 97% effective, even more effective if used with one of those physical barriers. $17 if you got Amazon Prime. Oral contraceptives, known as the pill, are a hormonal method that deliver fake estrogen, so synthetic estrogen, to prevent follicles from maturing or the egg from implanting. Unfortunately, women have reported weight gain, mood changes, and also effects on their menstruation with birth control, though a lot have positive side effects, like a reduction in acne and a reduction in cramping and uncomfortable side effects of menstruation. This one is really effective. We're talking 97, 99% and can be free depending on your insurance. So the pill is a very popular choice. Lastly, nope, not yet. Lastly, in the chemical hormonal category is an IUD. So this is a relatively new one that prevents implantation by up to 5 years. It will inflame the uterine tissues, preventing them from getting thick enough to host a fertilized egg. Unfortunately, it can cause irritation and cramping, and a lot of women have them inserted and then quickly removed. But if you're someone who can't remember to take the pill at the same time every day, don't want to, an IUD is as effective as the pill, though it can be pretty costly at $0 to $1,500, again, depending on your insurance. Lastly, surgical methods. If we want to make absolutely sure, we're talking over 99% effective, we have to cut the tubes. In men, we surgically sever the vas deferens so that the mature sperm never reach the penis. It's permanent, but it does require surgery, about $3,000. Same type deal in women, we can surgically sever the fallopian tubes so the eggs never reach the uterus. Also permanent, also requiring surgery, a little more expensive because it's deeper within the woman's body. Though both of these do have a slight failure rate because your body sometimes fixes the tubes. It can guide them back towards each other and sort of reverse itself. But these are the absolute most effective ways to prevent childbirth if that's where you're at in your life.